Well, next I have the honor of introducing our next guest, Mr. Paul Coleman. Mr. Coleman has 29 years experience in behavioral health care and has been President and Chief Executive Officer of Maryhaven for over 21 years. Maryhaven is Central Ohio's oldest and most comprehensive provider of behavioral health care with a specialization in addiction recovery care. And in terms of the number of patients admitted, it's the largest provider of behavioral health care in Central Ohio. Prior to his service at Maryhaven, Mr. Coleman was director of the Governor's Office of Recovery Service with statewide responsibility for alcohol and other drug policy. And prior to that, was engaged in the private practice of law. In the different role, I've had the privilege of working with Paul on various issues, and so I'm extremely pleased to welcome Paul to the podium.
Marcie, thank you very much for that kind introduction. As Marcie has told you, Maryhaven is the oldest and most comprehensive provider of behavioral health care in Central Ohio. We are also 60 years old this year. This is our 60th anniversary. We were founded in 1953 as a halfway house for women alcoholics. Ladies and gentlemen, in 1953, when Maryhaven was founded, marijuana was a presenting problem for many of our patients, and it is a presenting problem for our patients today. Marijuana, without question, is the gateway drug for the vast majority of our patients at Maryhaven. Out of the 7,000 patients we cared for last year, I would be surprised if more than 5% said they had never used marijuana. And more troubling, marijuana is the drug of choice for over half of our adolescent patients at Maryhaven. We have about 148 adolescents under our care at Maryhaven, most on an outpatient basis, and they tell us marijuana is their drug of choice, and that sometimes it is easier to obtain marijuana than it is to obtain alcohol. The side effects of marijuana are well known. They include addiction, extended periods of lethargy, and motor vehicle collisions. When I was practicing law, I had a client tell me once that the difference between beer and marijuana was this. With beer, you don't see the red light. With marijuana, you see the red light and you don't care. So the use of both while operating a motor vehicle is a problem, and law enforcement right now in our state and other states are beginning to educate the men and women who are the front line of law enforcement about how to detect the influence of drugs other than alcohol. Marijuana is one of them.